to the third episode of How to Get Away with Staffing. And yes, we have a title now. We have a title, figured it out. So we thought that'd be a really cool title for us and a fun way to talk about this industry. So How to Get Away with Staffing. This week, we have Jamie Henry, our Director of Operations and Healthcare Services, joining us. So welcome.
Thank you. Having a title makes it feel official. I like it.
Yeah, absolutely. Me too. So maybe we should start with this. You have a very interesting backstory. How did you get into the staffing market?
Yeah, no, that's a great question. So I have been doing staffing in healthcare for over 10 years now. But before coming to FoxHire, the focus was in a healthcare facility itself. So I worked for a large children's hospital and did bed control and staffing for the inpatient units, and then eventually managed the largest inpatient unit for that facility, handling all of the staffing. And during my time that I was there, I also served in addition on their staffing committee, which reviewed and approved all of the staffing plans for the various different units. So determining the right ratios between, nurses and patients and, allied health and patients, et cetera, for each of those different areas of care. And then
cool. So you're on the buyer
about 3 years
side.
ago. Yes, on the buyer side, very much so. So I was used to dealing with their contracts for their contingent work, which started out largely seasonal, right? And then even prior to the pandemic, we were starting to see, that seasonality was expanding. So instead of just needing that additional help from January to March, we were starting to look for that help, as early as September. And then we found we needed it over summer months. And so, the growth was already there well before COVID.
Okay. So you're talking about the growth and you're talking about COVID. Obviously, there's a massive growth in healthcare staffing because of COVID, right? The need was there. The opportunity was there. So tons of organizations got into the healthcare market, but the word on the street is the healthcare market is contracting. So is there still opportunity in the healthcare staffing market?
So that's a really interesting question. And I think it all depends on who you ask as to what they're going to tell you is happening in that market, right?
Okay.
So CEOs, ask the CEOs what they, how they gauge the staffing market right now for healthcare. They will tell you that it is still their number one concern is staffing their hospitals right now. And it's specifically their nurses and their lab technicians. And there's an annual survey that is done of the CEOs to rank their top concerns. Prior to 2021, it was spend. So it was looking at cost of supplies. Starting in 2021, it was staff. It was having enough staff and the cost of staffs, right? So not just the cost of it, but not having enough. So not being able to meet their ratios. So CEOs are telling us it is still very much a problem. There's still a lot of demand, right? Ask the bedside nurses, which is something that's also commonly done. AMN actually did a survey in 2023, and the results of that survey indicated that almost 90% of nurses felt that there was a shortage and that shortage would continue. So, I think that's what we hear too when we talk to people, and we hear that they feel that shortage. But the reason that the staffing industry feels like it's contracting is because those CEOs are looking to fill their need through other less traditional avenues, right? It's not just the staffing agencies that we've been used to in the past.
Where are they getting people from then?
Well, so they've done some interesting things. So it's we've gone back to two older models that we used to use, right? So increasing the size of their internal float pools, but turning them into really flexible staffing. So almost making their own internal agencies. So the hospitals are hiring the employees, but they're in part of their flex staff or float staff. So they may float between units, they may float between facilities, and they work a different flexible schedule and typically get paid a higher wage than the staff that are assigned to a specific unit, a specific shift rotation, et cetera. So that's one method.
Okay.
And we've seen some success with that, although it is interesting. There have been several articles in Becker's lately talking about how even the cost of that model is too great. And so now they're starting to cut those rates. And the nurses in those positions are getting very vocal. I guess there's been some recent posts on TikTok that have gone viral about rate cuts and nurses threatening to leave those positions because of it. So, it's been something of a solution that they thought was going to be successful that maybe isn't meeting the need quite the way they anticipated.
Interesting.
It's good in theory, but it's got its
So the
challenges.
float
It's still
pools, let's just talk
expensive.
about that a little bit, right? Like,
Yeah,
because I think the float pools, like, it goes along with some of the other ideas we've been talking about recently, which is this like idea of having your own internal talent pools, not just within healthcare, but within all of the
sure.
contingent workforce model, right? Contingent workforce leaders are talking about internal talent pools and direct
Mhm.
sourcing. Would you say that like hospitals have been doing that for a while then? Because it sort of sounds like the same thing.
They have. So that's actually been a common model for years to hire their own in-house like seasonal float staff. And then at the end of that peak season, when they're done floating them to the units that need assistance based on number of patients or how sick those patients are, they will then try to take these nurses that they've oriented to their systems and processes and assign them to units where they now have vacancies. That is actually how I first started at Akron Children's Hospital. I came in as a
Okay.
seasonal float nurse and then got hired on full time on a unit when my seasonal float position ended. So, yes, that's been a long-standing common model in healthcare.
Interesting. So other industries are sort of like pulling that and saying, "Oh, this is
Yeah,
direct sourcing. It's a new thing." It's not necessarily a new thing. That is what I'm
it's
hearing you
not
say.
necessarily new. No,
Okay. Okay. So you said that's one method. What's the other
that's one
method you
method.
mentioned?
Well, the other thing we're starting to see come back is like team nursing. And so what that basically means is that rather than having an RN provide all of the care for a specific patient, you look at how much of the care provided to that patient needs to be done under the scope of an RN's license. And the reality is, it's only about 40% of patient care on average needs to be done by the RN, which means more than half of the care that that patient needs could be done by a lower license level for less cost to the facility, right?
Yeah.
So it used to be a super common model that you would have like a nurse, an LPN, and a CNA or a medical assistant that would care for a group of patients. So if one nurse can typically take care of 6 patients, that team of 3 could care for 18 patients or something of that nature. That I'm making up numbers there, but they can care for a significantly larger number of patients with fewer RNs to cover the care. We drifted away from that model probably about 20 years ago, 15, 20 years ago, because it's not the most satisfying from a patient care standpoint. Those patients like the consistency of one person in and out of their room. They can provide what we call
Yeah.
clustered care. So there's some benefits to that too, right? It's less disruptive to the patient. But if you're looking at it in terms of both cost containment and availability of qualified staff, it's a better fit for what the healthcare industry is facing right now.
Okay. Okay. So there's sort of these two different ways that the healthcare facilities are trying to solve this problem, and it sounds like they're still focused on staffing levels as like a high priority.
Those are the two internal methods that they're using.
Internal.
Yes.
Okay. Yeah.
Yep.
So
Yep.
where's the opportunity? If I'm a staffing person, right? If I'm a staffing leader, if I run a staffing firm, if I'm listening to this, like, gosh, I really wish I could find a way to get into the healthcare market, or I'm already in the healthcare market, I want to keep growing. Like, where's my opportunity? Do you see anything that that would indicate like, okay, outside of these two internal methods or what I'm competing against would lead me to believe that like there's still growth here?
Yeah, so that's so funny. This was a huge topic of conversation in the American Staffing Association healthcare sector call last
Okay.
week. There were probably 30, 40 agencies on that call that week specifically. And this was a very common point of discussion. And several of them discussed some of the things that I think are more obvious, right? Like look to recruit other types of roles as well, right? Well, I think we've been saying that for a couple years now. So looking at
Sure.
allied health, looking at the lab space, et cetera. But several of them have said they've also gone back to sourcing for direct hire. So, working with their hospital connections who are struggling to find those direct hire candidates and, trying to source those direct hire candidates. There were only 2 agencies that said they'd really had a lot of success with that. Maybe there were others that just didn't speak up. But that was
Yeah.
one thing that was mentioned. There were several too that said they were trying to do more offering of like per diem type nursing. So rather than really chasing down those typical 6, 8, 12-week contracts that we all think of in the healthcare space, looking at filling the need shift by shift because the buyers in the healthcare space are a little less hesitant to commit on those shorter shifts because they're not, they don't have to have the burden of that bill rate if they don't necessarily
Yeah.
need those nurses, right? So
Yeah, for sure. Yeah, per diem is an interesting one. So I think that leads us into the per diem nursing model. Okay, is
mhm,
really interesting because there's new entrants into this market, into the per diem nursing model, and it's on your phone. Take a
correct.
shift, right? It's the
Yeah.
gig platform, gig economy, all that stuff, right? So the thing that I'm most aware of with the gig economy, as far as healthcare staffing is concerned, right now is all of this contention around the 1099 versus W-2 question, right?
Yes.
The the way I understand it right now, right, is like 1099s are typically being employed through gig platforms. Now, not all gig platforms are 1099, but a lot of them
Correct.
are, and that's
Right.
changing the dynamic from a pricing perspective. And it's pushing a lot of traditional staffing firms to put pressure on the government to say that that's not allowed, right? And so the Department of Labor comes out with this letter and ruling that is supposed to make it easier for people to know what's a 1099, what's a W-2. But most of the feedback on that ruling that I think came out a month or two ago was like, that just confused everything even worse. But in general, there's this overwhelming sense of like, we're going to get to a W-2 model eventually, right? Whether it's regulation, client pressure, like there's just a movement that's pushing us that direction. So I'd love to hear your thoughts on like 1099 W-2, like what's the history there? Why did they do this ruling? Anything like that.
Yeah, absolutely. Well, I mean, I think the history for why the healthcare industry has at least tried to trend in that direction is pretty obvious, right? 1099. So these can be done for a lower bill rate while giving the contractor a higher pay rate, right? So they're appealing financially to both of those sides, right? So not hard to figure out why there's an appeal to that. Plus, it goes back to what I said previously. It's a shift by shift commitment. So, the buyers on the healthcare side are much more open to this because they're not committing to a contract they may not, really end up needing. So, I think that part's fairly easy to understand. The reason the Department of Labor is coming down on it, and focusing on healthcare as one of the specific areas is because the nature of a 1099 is supposed to be that the contractor is able to control how the work is performed.
Right.
Um, Outside of like aviation and maybe nuclear power, there's probably not an industry more regulated than healthcare. So, the reality is a nurse does not determine how that work is done. The nurse does not control how that work is done. They're working under physician orders or, licensed independent provider orders. And they're following hospital policy and procedure, and they're using hospital equipment. So, the DOL
Right.
stance kind of makes sense there. So while it may have caused confusion for other industries, the American Staffing Association and the staffing industry analysts' position on this so far have been it's not confusing when you look at healthcare. When you look at healthcare, it's
Right.
actually clearer, right? They're not a fit for 1099. So the point that the DOL was making, and if you look at some of their recent, some of the staffing agencies that have recently lost lawsuits and had fines, et cetera, levied against them for these practices, the points that they make is that most of these nurses don't have an LLC. They're not an independent business.
Right.
They don't. The worksite supervision is intense, as we just discussed. It's a highly, highly regulated environment.
Yeah.
Their actions are directed by orders, has to be performed on site, et cetera, all those things. And then the risk to the employees when that doesn't happen is, they don't have the benefit of workers' compensation coverage or general liability. And it's also a high risk area. So it's not only highly regulated, it's high risk. So they don't have those protections as they should. They're not receiving overtime compensation. So, they're working at whatever this flat rate is, and they're not being given the overtime or the sick time or, any of the other benefits that you typically provide to a W-2 employee, such as healthcare and, those types of things. And the other thing too, again, somewhat more specific to healthcare than other industries, is they can't unionize. So as an independent
Oh,
contractor, they
interesting.
can't be a part of the union. Yeah. So
Oh,
something to
because they're
consider.
independent contractors or
Correct.
because they're nurses? Oh, okay. Sorry, I see. Okay.
Because they're an independent contractor. So the unions hold a lot of power in the nursing industry, a lot of
So if you're
power.
an
And as
independent
independent
contractor,
contractors,
then and you want to be a part of the union, you're just not allowed? Or like what if you're already in the union and you go become an independent contractor? Like what happens?
So that's a good question. I honestly don't know the answer to the second part, and we could certainly dig into that and find out. What I do know is that was one of the points made by the Department of Labor is they can't unionize. So it's like withholding a
But there's
right
already
from
existing
them.
unions.
If there's an existing union at that facility, not every hospital has a union, but
Sure,
every
sure.
hospital is subject to potential unionizing. There's nobody
Mm,
who's excluded from that
that's
necessarily.
so
So
interesting. I did not
yeah,
know that part.
yeah,
Okay, wow. Okay. So basically you're saying like the government's pretty clear that this is not supposed to be happening, but it's happening anyways, right? Like it's still
right,
happening, and there's two perpetrators, there's two groups that are sort of doing this right now. It's the very small, usually like nurse owner run, but not always nurse owner run, like staffing firms that are just traditional staffing firms placing nurses on a 1099, maybe in their local area. That's like their model. Like, and it's usually per diem, pick up a shift here or there, usually like long-term care facilities or like skilled nursing. That's where a lot of this like 1099 work is happening. Send somebody there for a couple shifts, over there for a couple shifts. It's all 1099. And it's because these small staffing agencies sort of popped up in COVID when there was a big opportunity and there was a
right.
low barrier to entry, and all these said, oh yeah, I
Yep.
can send my friends out to these different places. Cool. Like, let me get some quick business and build it up and sell it, right? Like that's exactly what a lot of these small staffing firms are doing. That's one. Scale there is very small, right? So like
Correct. Yep.
scrutiny and like the light being shined on this is very small, right? But then there's the complete opposite with these massively upscaled gig platforms that have thousands of workers out on assignment, and that's really where you're seeing a lot of the contention happen, because these gig platforms are sort of challenging the status quo from a process perspective that normal staffing firms that have been in this industry for a long time have been facing, and they're undercutting price points because they have a lower barrier to entry from a rate perspective, so they
Correct.
can offer lower bill rates while simultaneously offering higher pay rates to candidates because they don't have the employer costs associated with the model.
Right. Well, and just to clarify real quick, it's what looks like a higher pay rate. What those
Sure.
nurses typically don't understand is they still have an obligation to pay the taxes on that. And they don't
Correct.
have all of the added benefits that come with being a W-2 employee, right? Your compensation is so much more than just your paycheck when you're a W-2. And as an independent contractor, they're missing out on all of that. And that's much harder to quantify. So while that IC pay rate looks great, it's not really an apples to apples comparison, right? So, but yes, you are absolutely correct that those are the two areas that we see encroaching.
Interesting.
And that was a huge focus again in that ASA call. I know I keep going back to it, but it's because it is such a great, kind of snapshot of where the healthcare staffing industry is at this moment. And they were saying how frustrating it's been, how much of their business they've lost to the gig platform space. Like how many of their
Sure.
clients have openly said, no, 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 we use, ShiftKey or Care or any of the others that we've seen in that space so far, and that they're losing business to that, even though the ASA has very clearly taken a stance that you cannot legally employ a nurse as a 1099. So
And let's also be clear. We're obviously aware that there's many gig platforms that are trying to shift to a W-2 model. So it's not all gig platforms. First
yes,
of all, there are gig platforms that do W-2. There are quite a few, and that
yep,
we know of for sure that do W-2. But the ones that don't do W-2, I think, are also recognizing this. I know we're aware of a lot of, or a couple of at least gig platforms that are shifting from 1099 to W-2.
yes,
Not that we would say any names, but I think they're recognizing that. So,
absolutely.
you're sort of seeing like, okay, we got to get to this place where we scaled up and now we got to get to a W-2 workforce. But in the interim, if I'm a staffing agency that's getting my clients encroached upon by these lower bill rates and things of that nature by the gig platforms, and maybe that's not the only reason that these clients are choosing gig platforms, but if that's the case, right, it's a pricing issue. Is there any recourse? Are you seeing fines or things levied against some of these firms for 1099s as an example?
Absolutely. So yeah, so it's funny you say that. So for starters, there are some class action suits in progress against some of these gig platforms, right? So
Oh,
don't
interesting.
necessarily have rulings on those yet, but you can, if you just do a Google search, you'll get a couple to come up. So like you said, not name names, especially since those are pending. But there are some others that are not pending, right? So like there was a comprehensive healthcare management services, which is a staffing firm out of PA, ended up with 19 million in back pay. So they're not a gig platform, like, to be clear.
Yeah.
But it was still because they were using the independent contractor model. They were 1099ing RNs, LPNs, and CNAs. And so that 19 million was in back pay. And what's interesting is it dated back to 2015. And
Yeah.
the
They'll go back and get
ruling,
you for previous
they
years.
went back, and the ruling made them catch it up to current day's wages. So think about, right? So 2015, pre-pandemic, what the wages were versus what they are now, made them catch it up when they paid it. So pretty stiff fines. And then there was another one, Steadfast Medical Staffing was another one that's been in the media, and they had 7.2 million in back wages and liquidated damages for what they were considering rightfully earned overtime that wasn't paid because of the flat rate associated with independent contracting versus W-2 employment.
Interesting.
So, and there's lots more. We could keep going, but one of the quotes actually in the one in the ruling against Steadfast, there were two comments that really stood out. There was a statement: when employers misclassify employees as independent contractors and fail to pay workers their hard-earned wages, the U.S. Department of Labor will hold them legally accountable. And that was from the U.S. Secretary of Labor, Marty Walsh. There was a second comment that said the court sent an unequivocal message to Steadfast and other healthcare industry employers that the Solicitor of Labor and the Wage and Hour Division will work together to recover stolen wages when employers violate the law. And that was Solicitor of Labor Seema Nanda. So,
okay.
they're making a clear statement that they don't see this as a legal method of employment in the healthcare space.
Pretty clear.
And they are taking strong action. So
pretty clear. It's pretty clear. So interestingly, like a lot of, I think, the staffing firms and other professionals in the space we talk to associate the 1099 W-2 issue with the IRS. Oh, the IRS is going to go. It's not the IRS.
Not the IRS.
This is the Department of Labor. This is a totally different conversation.
That's right. Because the IRS is thinking more about the money, right? Department of Labor is out to protect these employees. So
correct.
It's
not just about taxes. This is the majority of the fine is probably just the back pay itself. It's not even the fine, right?
That's correct. Yep. A lot of it is the back pay. That's correct. Yep.
Okay. So if I'm a traditional staffing firm or even a gig platform that's competing at a W-2 level, not a 1099 level, I am maybe encouraged to see, like, okay, people being held accountable. This is, going to move, towards the correct direction. And this period of time where 1099s are acceptable is going to be short-lived. And I just have to basically stay steadfast and communicate the value of W-2 employment is sort of what I'm hearing you say.
Yeah. And, it's interesting too, Colin, another thing that might help to persuade some of these clients, especially if they were the clients of these agencies previously before the entrance of the gig platforms in those spaces, clients are being levied with the fines as well. So when the DOL cracks down, they are looking at this as an issue of both the gig, and not the gig platform, because again, we haven't seen the rulings there yet, but as far as the agencies that have had fines levied against them, they're often naming and fining the client site as well. So the client doesn't get to just get off scot-free.
Yeah.
So, and I think that's why we are starting to see a push, right? We have certainly had multiple agencies approach us in the very recent past and say their client is now insisting on W-2. And we're seeing it in some of the state licensure. So some of these state agency licensures, again, because they recognize the model of W-2 as being appropriate for this space, are stating that in order to be licensed as an agency, you have to employ the employees as W-2s. We see it with MSPs too, right? Same thing. A lot of them say it has to be a W-2. Yeah.
Yeah. So there's a number of different pressure points, right? So I'd like to jump to a couple of them. But yeah, like as an employer of record, we do get some of the gig platforms approaching us, as well as traditional staffing wanting to move from this model. So there's definitely help. Like if you on the other end of the spectrum, if you're a gig platform listening to this that is doing 1099 or traditional staffing firm that's doing 1099, you have options. Like obviously you could do it yourself and build your infrastructure, or you could partner with an employer of record to enable that to happen quickly, right? So there are options for those that want to get into compliance with the DOL on this issue. But one of those pressure points driving 1099 to W-2 in this space is, I think, another trend we're seeing in the last couple of years, which is agency licensure. So I think before the pandemic, it was like not a thing at all. There was like a couple of states, and now there's like almost half the states require some level of agency licensure. And when I talk to staffing firm leaders and owners, sometimes they're like, what are you, you mean, I'll say licensure, and
Right.
they'll think, oh yeah, we credential our staff. We credential our staff. It's like, no, we're not talking about that. We're talking about your agency needs to be licensed to offer healthcare staffing in your state. So maybe just explain like what is healthcare agency licensing and why is it important?
Yeah, absolutely. So we like to joke that it's the wild, wild west of compliance, right? So like two terms that don't go together, but it feels that way right
Yeah.
now because the number, like you said, the number of licenses being added is it's they're coming hard, they're coming fast. There is no like established timeline for when they hit, right? So it's just a matter of when that bill becomes a law. And so, you know, a lot of times we are just kind of watching, waiting, and then taking action to get licensed. So every state looks different. Good old US of A, it's just how we operate. No two states are standard. So you really do have to keep up with that ever-changing landscape, know where licenses are, you know, pending becoming law, and then dig in. And these laws they're long, they're intense. A lot of times the application processes themselves can take several months, and then you have to have that application reviewed. You know, the requirements vary by state. Some are just a simple registration fee, and you pay that annually, and you're done. You know, that actually used to be the way Maine was. It was a $25 fee, and you're registered for the year, and you're done. They just announced
Simple.
changes. Used to be just announced changes in the fall of 2023. It's now like a $3,000 fee per year. There's all kinds of upfront application process, and then there's quarterly reporting tied to it as well. So, you know, again, every state varies. Some actually go to the extent of having to have a licensed nurse on staff. And some even require a nurse licensed in that state on staff. I've actually had to acquire additional state licensure just to keep us licensed in certain states. So, you know, it is very complicated. It does require a lot of focus, and the fines are pretty stiff if you violate the license. So, most of
Mm.
these states that have now implemented a license do say if you are not licensed, you're no longer permitted to provide, you know, contingent healthcare staffing without that
Yeah.
license.
How many states is it now?
I
Like
believe we're up
20?
to 24 in total. And I think so if I'm not mistaken, that doesn't count Tennessee, where we're still waiting for the application to come out. It hasn't even been posted yet.
So basically half the states. And so
Half
if
the
I'm
states.
a healthcare staffing agency in, let's say, California, but I want to provide staff in Florida, can I,
Yeah.
do I need a license in California and Florida?
Well, so California doesn't have a licensing requirement yet, but you
Okay.
need that
Okay.
license in Florida. It matters where the nurse
Got
is
it.
going to work.
Where the
And
nurse
what's
is going to work.
interesting, it matters where the nurse is going to work. Right. So, yeah. So, wherever that nurse is going to work, that's where that license needs to be.
Got it. Okay, so that's another pressure point that's like driving the 1099 to W-2 and also just like influencing the healthcare staffing market in general. Why do you think all these licenses are coming about? Like what are all these states doing this for? Why all of a sudden after all these years doing it?
Yeah, it's interesting. So, I mean, I think there's a couple different things playing in. It is a highly regulated industry, right? And if you look at what each individual healthcare system puts in place for its own onboarding, the requirements are pretty stringent, right? And a lot of our staffing agencies aren't necessarily following those. So they may be supplying staff that haven't met the full, you know, vetting and onboarding criteria that you would see, right? So the other thing too is you don't really have to do anything to be determined to be a healthcare staffing agency. So,
Right.
you know, what level of expertise do some of these agencies have to be placing a healthcare staff and to know that the staff they are placing are going to meet the requirements of those facilities? So, a lot of states do require some basic healthcare records like TB and physicals. Most have a heavy emphasis on ensuring that the licensing is up to date. There's no findings in the background. They're fairly extensive background checks. A lot are like level 2 fingerprinting or state registry checks. So, things outside of your standard criminal background check that we're all used to doing, right? There's a lot of like competency assessments, skills checklists. So more than just asking the nurse for the resume, really wanting to make sure that the healthcare
Interesting.
staff are qualified.
Yeah.
And some we're seeing looking at it from a cost containment standpoint. So they're putting in capped bill rates. They have requirements that you have to present the signed contract with all pay rates to the state within 5 days. So there's things like that too, where, you know, there's definitely some state
Yeah.
oversight on cost.
that was the biggest thing that obviously and during like COVID, I think even hit the normal like news wire and was a big hot topic amongst almost the whole country, which was like how much nurses are being paid and how these hospitals sort of had to pay the rates because they had ratio numbers to meet. If they didn't have nurses in there, they couldn't meet the ratios. So, you know, the unfortunately, I think there was this idea that staffing firms were gouging their clients. And I don't know that staffing firms were necessarily
Right.
gouging, but it put the spotlight on like the pay and bill rates for these different individuals. And I think the states reacted accordingly.
Yeah. Yeah. I agree. I think that's a very large part of it.
Yeah. So obviously COVID-19 really impacted that. And since then, we've sort of seen a retraction in the overall spend. It's still, there's opportunity, obviously, and there's still focus, it sounds like, from CEOs of hospitals and healthcare organizations to be like properly staffed. And it's a big priority for them, but there has been a retraction. So I guess what's driving that? Is there anything that you can point to that says, you know, these are reasons why maybe there's less staffing opportunity than before?
Yeah, I think it goes a little bit back to what we talked about before, where I'm not sure that the staffing opportunity itself is gone. I think it's shifted. So again, I think those internal methods that we discussed. I think if you look at the latest SIA report, to me, it was really interesting to see the increase in the per diem. So, you know, where traditional staffing agencies that focused in travel nursing saw actually a 1% decrease, or I'm sorry, 6% decrease in 2023,
Yeah.
the per diem nursing space saw a 14% increase. So again, looking to fill more through that newer
Shift-based.
method. So I think it's still there. The other, again, anecdotally speaking, we are hearing that there is more like hospitals looking to actually source and hire their own candidates and build those own internal pools. So
Yeah, the direct sourcing model, I think, is taking effect. And we know we've seen that from different opportunities we've been brought into. The direct sourcing opportunities in healthcare are definitely there. But a lot of that is managed through like an MSP, a vendor or a vendor management
correct.
system, VMS.
Yes.
So that's another pressure point I feel like you mentioned that's driving
Yeah.
a lot of this compliance related pressure on staffing agencies. So, I mean, I think I want to say like the majority of the market uses an MSP or VMS in healthcare, right?
Yeah, absolutely. So the statistics I found a range of between 70 to 80%, which matches with what we typically hear, right? Like I think we weren't surprised by those numbers one bit. So yeah, 70 to 80% is utilizing the VMS or a VMS or MSP for their contingent staffing.
Right, and those organizations require high standards for any of the vendors, so staffing firms in this case, vendors or staffing firms, to meet in order to even get in and be able to place healthcare professionals at their clients.
Absolutely. Not only do they require, do they have a high barrier for entry, which, that's, I think we're seeing that increase even more so. That's been our experience. But, just within the past 2 months, we've received communication from several large ones that we work with, letting us know, not that we've been impacted, our suppliership is fine, but it was a general message to all suppliers that they've reduced their number of suppliers based on the number of staff provided, right? So like if you weren't meeting certain metrics, they removed you from the program.
Yeah.
And one of them even went so far as to say, please, if you've been removed from the program, please don't contact us. This is a final decision. So yeah. So, I mean, I think, one of your favorite terms that you've taught me is bloody ocean, right? So I think the healthcare staffing industry is a bit of a bloody ocean right now. And the MSPs in particular are feeling that. I think they got flooded, and the reality is they're just working to try to meet the demand of their clients. But I think it's, everybody's fighting over a limited talent pool right now.
Yeah, no doubt. Yeah, it's not as graphic as you might think, folks. But yes, it does feel like you're competing with a lot of different players out there. So, I mean, if I'm a staffing firm, right, like I'm competing with traditional staffing firms in my market. I'm competing with gig platforms. I'm competing with my clients trying to find their own people. I'm competing with MSPs and VMSs. Like there's a lot of people trying to get their chunk of flesh in this market. So you really got to understand your niche and what you need to do to be compliant in your niche before you really try to make a big impact, or else you could be spinning your wheels or finding like erosion of your customer base if you're already an established firm. So yeah, it's a very, very interesting and dynamic market though.
It is, but one of the things that was really interesting, Colin, is JAMA published a study of nurses, and what they're looking for. And what was one of the things that stood out to me was the nurses identifying how important the connection and trust in their recruiter is. So we keep talking about all these like high tech, low touch, right? Because the MSPs and the gig platforms, et cetera, not that there isn't people involvement, right? But one of the reasons they're so scalable and able to, grow into the market as fast and as far as they do is the leverage of technology. You got it.
Yeah.
But what these nurses are saying is, I want a connection to a human when that technology doesn't work. And not just a human that I know and a human that I've developed trust with, right? So when you think about, they show up, let's say it's a travel assignment. They show up and the assignment's been canceled. They don't want to pick up the phone and talk to some random person who's going to read them a script. They want somebody who understands that they committed to that. They uprooted their lives. They want somebody who's committed to them to help resolve the problem, right? Even when you're talking shift work, like this nurse has driven however far, shows up and finds out
30 minutes, 45 minutes.
Yeah, their shift's been canceled. And so now, their whole day has, completely changed. Or, some of the examples I read were even smaller, seemingly simpler things than that. But like, one had been docked for attendance issues and was being penalized and being threatened to be cut from access to the gig platform because of a perceived attendance issue, but it was really because the client had failed to go in and log that they canceled the shift, not that the nurse hadn't worked it. And she couldn't get anybody to help her resolve that. There was another instance of somebody who wasn't receiving their pay. And, it was because the client wasn't approving that they had worked the hours, but the nurse had, documentation. It was, so anyway, lots and lots of examples of where they still want that high touch for a staffing agency.
Yeah, customer experience.
Yeah. So for the agencies where that's been your model, yeah, when you're fighting for a limited talent pool, it sounds like that's what that talent pool is asking for, right? So they want
high quality candidate experience, especially when there's a nursing shortage. If you want to have repeat business, if you want to have repeat placements, right, you need to be able to deliver a really strong candidate experience because they're not going to trust you after the fact.
Especially in an industry where right now they don't trust the clients they're working for necessarily because they're still feeling some of that residual sting from the pandemic where, they didn't have access to supplies. We weren't getting information in real time. And, if you look at the overall survey results of a lot of nurses in the industry right now, they don't feel as positive about their jobs as they used to. So being able to have that positive, trusting connection with somebody might really be that, that leverage point for keeping that nurse with your staffing agency versus a gig platform.
Yeah, no doubt. So where do we go from here? Where do you think the staffing market looks like in healthcare in the next 5 years? What do you think some of these trends are going to look like?
Yeah, so we can't get away from technology, right? It's going to happen. And in all honesty, it should, because it helps to keep costs down. Technology does help to keep costs down. So it is the direction we should be going, but it should be smart technology backed with that healthcare, that trusting connection that you have, right? So, I think we're going to continue to see growth in the gig platforms, but I think they are going to have to shift to W-2. I think the pressure's there. I kind of think, it may take a year or two for that ball to really start rolling. But as the DOL continues to focus on that area and there continues to be, more litigation and we see more fines, et cetera, I strongly suspect we're going to see a transition from the 1099 to the W-2 model, even in the gig platform. Same with the MSP and VMS space. I think that the technology is already there, but I think we'll start to see some improvement. It looks like it kind of scaled in the direction of hyper compliance really fast, which has made onboarding extremely expensive. And so I think we're already starting to see some of that soften a little bit, and hopefully that trend will continue. Definitely makes it easier for agencies to get their contingent staff placed, right? So hopefully we continue to see that trend. And I do think we're going to continue to see some of these new models that we're seeing within hospital systems, right? The team nursing, the internal pools, maybe the team nursing more than the internal pools. But with that team nursing growing, I think we'll see contingent opportunities within that too. So where we typically didn't staff a lot of LPNs and CNAs necessarily in hospitals, and that was more of a long-term care model. I think we'll see some of that trend towards hospitals again too. So there should be some additional openings in those spaces for those roles.
Cool. Okay. Well, hey, this has been great. I mean, obviously, if you guys don't know Jamie Henry, you do now. A lot of great information. So thank you, as always. Great information. I really appreciate it. And we hope you guys found this valuable. And we hope to see you next time. Appreciate it. Have a great day.